Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. In this episode, a look at homelessness in America today. Journalist Brian Goldstone is the author of a new book, There's No Place for Us, Working and Homeless in America. He talks with me about the profile of homeless people and how it's changed dramatically in recent years as more and more families with working parents are being priced out of affordable housing. We also discuss the woefully inadequate support systems currently in place and how things are likely to get much worse. Let's listen. Brian Goldstone, thank you so much for joining us on Public Health on Call. Tell us a little bit about you and your work.
I am a journalist. Before that, I was an anthropologist. I guess I still am an anthropologist, but I was more firmly sort of situated in the academy. I have a PhD in cultural anthropology, but for about the last 7 or 8 years, I've been working primarily as a journalist, writing kind of long-form magazine stories. And one story that I wrote for the New Republic in 2018, 2019 led me to write this book.
And tell us a little bit about your book.
Yeah, so the book is called There Is No Place for Us, Working and Homeless in America. And it follows 5 families here in Atlanta where I live who are working full-time. The parents have not just one job, but in some cases, multiple jobs. And it's not enough to secure stable housing for themselves and their children. And so the book follows them over a period of, in the book, of about 2 to 3 years. The reporting itself and the research itself went for about 5 years, but it follows their journeys and their just desperate attempt to get housing, and it shows all of the obstacles in the way of them obtaining it.
So your book highlights a profile of homelessness in America. Tell us a little bit about this particular landscape.
Well, the book focuses primarily on the rise of what I call the working homeless. I first came to this project actually through my wife. My wife is a nurse practitioner, and she was working at a community health center in Atlanta called Mercy Care. And she would come home from work and tell me about patients, this trend she was seeing among her patients. They were working at Walmart. They were working at McDonald's. They were driving for Uber and Lyft. They were packing boxes for Amazon. And at the end of their shifts, they weren't going to an apartment. They were sometimes sleeping in the car that they had just done an airport run and Uber and Lyft for, or they were sleeping in the overcrowded apartments of others. They were going to homeless shelters if there were any shelter beds available. And above all, they were going to these squalid extended stay hotels, which I came to discover were sort of extremely profitable homeless shelters that exist in the absence of a shelter system. So my wife noticed that and she told me about it. I was shocked. I was shocked to hear about this phenomenon, this trend. And that was the initial spark for me. It led me to ask, how pervasive is this, that people are working and they're still homeless? I remember typing the term working homeless into an academic search engine around that time and was shocked that there was virtually nothing explicitly thematizing that link between employment and homelessness. And when it was discussed, it was negatively. Work was what was missing from the experiences of those who have been deprived of housing in America. A job was presented as the exit from homelessness, not an accompaniment to it. And I was just astonished that no one was really talking about that. And as I began to dig in and investigate, first here in Atlanta and then reporting on this around the country, I saw that those who have jobs actually comprise the overwhelming majority of people experiencing homelessness in America, and that homelessness itself, that what we see on the street and really the official numbers is just a tiny, tiny sliver of the true magnitude and the true scale of homelessness, that there's this entire kind of world of homelessness that exists out of sight that is not just invisible, but that has been actively rendered invisible. And so that's a lot of what the book explores, is how that invisibility came about and what life looks like and feels like in what I call the shadow realm of homelessness that primarily families with children are currently trapped in.
I know you've done some work on the census, which takes into account or tries to take into account the sheer number of people that are homeless. What definitions do you use for homelessness?
Well, it's important to note that homeless resources in this country, as well as the official numbers on homelessness, come from HUD. HUD has defined homelessness very narrowly. They use a definition of what they call literal homelessness, and that includes only people who are in shelters or on the street, who are visible on the street, or are staying in other sort of environments not meant for human habitation, like an abandoned building. The Department of Education, another federal body, which hopefully will still exist by the time this conversation airs, the Department of Education defines homelessness much more expansively. It includes students, families with children who are doubled up with others, who are living in hotels and motels, because schools, school social workers, principals, teachers, they noticed over the years that their students who are stuck in these really precarious arrangements, often, again, in cities and areas where no shelters were even available for families, that these children were being exposed to the same vulnerabilities, the same toxic stress, the same adverse outcomes educationally, health-wise, as children in situations that HUD defined as literally homeless. So the Department of Education uses a more expansive definition, and that is the definition that I think is more helpful, that more accurately reflects the experience of families with children who are homeless in this country. But again, the numbers that make it into the headlines, and crucially, the resources that are available are dictated by this much, much narrower definition. And, I argue in the book that narrow definition, that sort of limiting of the scope of homelessness, that is not just an accident, that is actually an engineered fact about homelessness in America that has attempted to narrow the lens, which both distorts our understanding, again, of the true scale and magnitude, but significantly also distorts our conception, our understanding of what causes homelessness and what it actually looks like.
And so what does cause homelessness? What have you found about what's behind the prevalence of this, particularly among working people?
Reason why homelessness is skyrocketing in this country, the reason why over the last 2 years, the official numbers have told us that homelessness is at the highest level on record. And I show in the book, by cobbling together different data sources, that the true number is closer to 6 times greater than that official number. So we're talking about 4 million men, women, and children who are unhoused in this country right now. What has caused that skyrocketing homelessness is one thing and one thing only. It is a lack of access to housing that poor and working class people can afford. Period. That is what causes homelessness. Now, of course, there are any number of risk factors that can lead someone to become homeless quicker. It can make someone more likely to become homeless. So the foundation, sort of the background, is this growing chasm between people's incomes, the wages that they're earning, and what it costs to afford a place to live in America's cities. That is sort of the baseline of what causes homelessness. But But of course, if you are struggling with mental health issues, of course, if you're struggling with substance use, of course, if you have PTSD or you're a victim of domestic violence or you're Black and have been systematically locked out of stable housing over generations, of course, there are all sorts of risk factors that can make it more likely that you experience homelessness. Of course, this is racialized. Of course, disabilities and other things enter into the equation. But I just think it's important to be absolutely clear that the reason homelessness happens is because people don't have homes they can afford. And, when we're talking about the working homeless specifically, it's important to attend not just to the homeless side of that equation. And of course, housing is a key element, but also the working side. And it's not just that, since 1985, rents have outpaced income growth in this country nationwide by 325%. It's not just the fact that in America today, there is not a single state, city, or county where someone working full-time at the local minimum wage can afford a modest two-bedroom apartment. It's not just the incomes. It's not just the wages. When we talk about working homeless, we have to talk about the nature of work itself, that work itself has become ever more volatile, ever more insecure and precarious, where people don't have health benefits. They don't have sick leave. They don't know how many hours they're going to be getting from one week to the next, or whether they can schedule childcare because they might be scheduled for an overnight shift, and so on and so forth. There's all sorts of things that have made work through the sort of gigification of entire sectors of our economy and the contracting out of work to third-party contractors and so forth that has made work itself more insecure. So it's that toxic mix of what work has become and what we've allowed housing to become in this country that has produced this staggering rise of not just the working homeless, but homelessness in general.
And there are programs to help with these things. But, your book, there are so many stories about people that are just cobbling together these resources, their vouchers, their lottery programs. They're jumping through all these hoops on top of multiple jobs, childcare. Maybe they're caring for other family members. Why are the resources not meeting the problem at all?
Well, yeah, it is really mind-blowing how mismatched the need is versus what has been made available. A well-known statistic is that for every 4 families in this country who qualify for housing assistance, who check all of the means-tested boxes, only 1 out of 4 families who qualify actually end up receiving that assistance. So this has been the status quo. The status quo has been just a safety net that is just woefully out of sync with what the need is. And what we're seeing with this current administration is gasoline being poured on that problem. We're seeing an already threadbare safety net just actively being shredded further. And I think it's not unrealistic to expect that 1 out of 4 number of people who are actually able to access assistance will grow to 1 out of 6, 1 out of 7, if housing assistance isn't just gutted altogether. So it is really, really astonishing how just the magnitude of what people are dealing with and how utterly non-existent for most people resources are. And that is especially true for people who have already been pushed into homelessness. And I use that term deliberately. I don't like talking about people falling into homelessness as if they just stumbled into it. No, this is an active phenomenon of people being pushed, of such preventable measures that can be taken to keep people in their homes that haven't. Once you become homeless, the resources that are available, that just trying to go to your local coordinated entry site and access assistance is, what I say to those, friends, colleagues who say, why don't they just go get help? Why don't they just go to, here in Atlanta, Gateway Center? Every city has their own version of Gateway Center where scarce resources are parceled out in a kind of triage manner. What I say to people when they say, why don't they just go get help, is you try it. You call the number. You go line up before dawn outside that building and you see what happens when you tell them your story and you want to get help. It is very, very hard, if not impossible, to get help if you are a family experiencing homelessness or an individual.
You've alluded to the fact that the rhetoric right now is certainly not going to improve the situation. But I do want to ask, is there anywhere in researching your book or anything that you've seen, are there programs that are being successful or models that we can look to or places where affordable housing is actually prevalent?
Yeah, I mean, I think it's important, especially at a time like now, to find hope where we can. And, what I try to point to in the book are examples of community mobilization and tenant organizing, grassroots organizing that is really demanding that policymakers take seriously what not just tens of thousands or hundreds of thousands of people are experiencing right now, what they're suffering through right now, but millions of households are experiencing right now. And it was that grassroots mobilizing that led during the pandemic, early in the pandemic, to an eviction moratorium, first in local municipalities and states, and then the CDC eviction moratorium. That wouldn't have happened. Those millions of people wouldn't have been kept in their homes. And we saw during that time how losing your home was a public health risk. Like, it could literally be a death sentence if you lost your home at that time. That moratorium happened because of grassroots mobilizing. That is where I draw inspiration and hope right now. And yeah, there are cities that are doing it right. There are nonprofits. Mercy Care here in Atlanta, they have a street medicine team that is meeting people where they're at. They're not expecting their clients and patients to come to them. They're going to them, and they are saving lives. So there are really incredible things happening at the local level. But I think, those closest to this problem are also those who are best equipped to tell us how to get out of this. And that is really where I draw hope right now.
Last thought, as we watch the criminalization of homelessness, the moving out of people, the consideration that homelessness is somehow a blight, what's one thing you hope people keep in mind?
What I would love for people to keep in mind is that the stereotypes and myths that have been perpetuated very deliberately about homelessness since this crisis first erupted in America during the 1980s. First, I think it's important to remember just how recent this is. And if it is recent, that means we can get out of it. If this is a policy choice, if this is the result of very concrete decisions, then that means we can make a choice and make very particular decisions to get out of this. But those myths and stereotypes that emerge to really control the narrative around homelessness, to obscure the true causes, to obscure the socioeconomic roots of this crisis, that is something that we are continuing to live under today, in whose shadow we are still trying to just get people to have compassion, to have empathy. But when we look at why people are actually losing their homes, why our streets, and not just our streets, but these hotels, why people are sleeping in their cars, is because we have allowed housing to become a commodity. We've allowed housing, this precious human necessity, to just essentially be hoarded up and then auctioned off to the highest bidder. And, a caseworker in the book, Carla Wells, she refers to this as the housing Hunger Games. So I think what I would love listeners to walk away with is the realization that this housing Hunger Games, it doesn't need to be like this. We made certain choices to allow the private market to be the primary purveyor of housing for not just tenants in general, but poor and working class tenants. And the private market will never be incentivized to take care of people's housing needs. So I think my hope is that this book shocks people out of a kind of comfort with the status quo and what we've allowed housing to become.
Brian Goldstone, thank you so much for joining us on Public Health on Call.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Sasiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.